Thank you, Chairman Cox, and a special thank you to all of the public officials who are joining us here today. You know, in January, when we started addressing this issue, we did it out of an abundance of caution. We also did it out of the understanding that the situation, the severity of it, was likely to increase. In February, when we were one of the first local jurisdictions, counties, to declare a public health emergency, we did so out of an abundance of caution, but also with an understanding that based on global trends, the unique nature of COVID-19, that the situation we faced was also likely to increase in severity. And we're standing here today to provide an update on the increased severity and the increased course of actions that we are going to take. I do think it is important to note that in San Diego, this is not a partisan issue. This is not a jurisdictional issue. This is not this group versus that group. What you see represented here today is all sectors and all aspects of our community standing together to speak with one voice, because the challenges that impact our community impact all aspects of our community. And I think that the residents of San Diego should be heartened to know that every possible step is being taken, that we are being collaborative, we are being progressive, we are being aggressive, we are being transparent, and we are doing everything that we can here today. The reality is the resolve of our community is stronger than the strength of any virus. The actions that we've taken so far and continue to take are all designed to protect the public health of the residents of San Diego County. We have a number of important updates to address on new positive test cases, new public health orders, new advisories and guidance, along with statistical updates on specific steps that we're taking. And we ask for your patience as we walk through all of these issues, and also your understanding that the situation we're encountering is a very dynamic one. It is a very fluid situation. It is something that literally changes hour by hour and day by day, and we will continue to provide regular updates. I'm going to walk through 5 areas of importance that we want to update you on, and then our public health doctors and experts are going to provide more information and more expertise around each of those areas, and we will also have an opportunity for questions and answers. First, an update on the number of new cases. Today, we have multiple new positive cases of COVID-19 to report. Dr. Wilma Wooten will walk through these cases, sharing as much information as she can, but we now have 5 new positive cases, in addition to the 1 positive case that we reported last week. With these new positive cases, the evidence is pointing to the very likely reality that we now have community spread in San Diego County. This changes both our posture, this also accelerates our action, and we are moving forward with the assumption and operating under the premise that we do have community spread. Now, a lot of the things that we're going to talk about are designed to try and flatten the curve. When you see a lot of jurisdictions that have experienced significant challenges, you see a huge spike in infections and hospitalizations. We are taking action to try and lower that, to lower the curve, to slow down the rates of infection, to slow down the rates of new cases. And we are doing that not only to protect the public health, but we're doing that to protect our healthcare system. We want to desperately avoid any overtaxing or overwhelming of our public health system. And so all the things that we are announcing today are designed to do that, to try and lessen the severity, lessen the rapid acceleration, and make sure that we have all the health services possible available for our residents who need them. So with that, 3, we're issuing a public health order today. Last night, the governor of California issued an executive order to limit mass gatherings of 250 people or more throughout California. In the county of San Diego, we're issuing a public health order that effective midnight tonight, any mass gathering of 250 people or more is banned in the county of San Diego. This includes all jurisdictions throughout the county of San Diego. This legally enforceable order is in effect for now through the end of March. Those gatherings that are under 250, we are strongly encouraging them to ensure the social distancing spacing requirement of 6 feet before each individual. And while this is a legally enforceable action, we are asking for the public's help. We are asking for the public's cooperation to help us ensure that these mass gatherings are not taking place, to help us ensure that we are avoiding environments we're given the unique nature of how rapidly this virus can spread, that it has the potential to spread to the greatest number of folks. The simple fact is this virus is highly contagious. We know that it is currently spreading throughout San Diego County, and we need everyone to come together to take action to try and limit that spread. This step, while inconvenient, is an established best practice, consistent with federal guidance, with state guidance, and in full support of our local public health experts based on the situation that we face here on the ground in San Diego. A part of our public health order today also includes specific directives to our hospitals and healthcare facilities. We are directing them to limit non-essential personnel from coming in or out of healthcare facilities. We're also providing specific guidance around how they should treat essential personnel who may experience symptoms. Maintaining the health of our healthcare system is of vital importance, and protecting the vital workforce in that healthcare system is a key point of our ability to effectively address and confront this situation. In addition to the official public health order, we are issuing a new advisory. We are advising, strongly encouraging and advising all senior citizens age 65 or older, along with any person, regardless of age, who has a chronic illness, to cancel non-essential travel, to prioritize staying at home, and to avoid large crowds or mass gatherings of any amount. We know that this virus is particularly impactful for our senior citizens and for those with underlying chronic health conditions, and we are asking those individuals to go above and beyond the established public health advisories on what we want things to do. Now, the risk to generally healthy younger folks remains very low. The primary risk for those folks is the spread to those vulnerable populations. And so we are trying to target those vulnerable populations to have a positive impact. All of the existing public health advisories remain in effect. Wash your hands, stay home if you're sick, cover your cough or sneeze, practice good health habits. And we want to reiterate to the public how important those are, because those are the steps each and every one of us can choose to take in our own daily action, not only to protect ourselves, but to protect our loved ones who we might be at risk of spreading it for. Today, we're also going to provide a number of updates. Dr. Wood will provide updates on our testing capacity, on our testing protocols, along with the steps we are taking to try and be innovative, to try and expand that, to provide more opportunities. We're providing an update today on the situation with Miramar. This is the repatriation of the individuals from the Princess Cruise Line. On Tuesday, we received 42 individuals who were flown into Miramar. Yesterday, we had 2 flights, and we have arrived 235 additional individuals. We are expecting another flight today, perhaps as we're speaking. Our current estimates are that there will be around 400 individuals repatriated from the Princess Cruise Line here into San Diego County. And as a county, we're going to shoulder our share of the load, perhaps more than our share of the load, to protect Californians and those who are in need of help and assistance. And we will do that in coordination with the military officials and with the state of California. Yesterday, we talked a lot about the hand washing stations, and I want to update you because this is vitally important for protecting vulnerable communities. As of right now, the County of San Diego has installed and funded 114 hand washing stations throughout the county, including the unincorporated portions and communities. We have an additional 54 that are in process of being deployed to MTS, to transit centers and riderships. We expect all of that will be completed this weekend. 10 jurisdictions, including MTS, have made requests for installations, and we are fulfilling each and every single request we receive. We expect more jurisdictions to make additional requests, and as we get those, we will fulfill those as well. Additionally, we have a challenge with individuals who might be a person under investigation or who might have a positive test, who do not have a home or a location to go self-quarantine or self-isolate. This is particularly acute perhaps with individuals from the Princess Cruise Line, a senior who might be in a senior living center who is a person under investigation or a positive test. We don't want them to stay there. They have nowhere else to go. Or it is particularly acute for our homeless and unsheltered individuals. As of right now, the County of San Diego has secured 90 motel rooms that are appropriate and available to house and shelter these individuals, along with providing the care that they need to deal with the situation. And although we are at 90 right now, we are in active negotiation and participation to expand this number. We're looking at a variety of options, because what we don't want is individuals to automatically go to the hospital. Unless you need to go to the hospital, we do not want you to occupy the critical space that we need in our healthcare system, and so we're moving to have options available for those individuals. And then finally, we're continuing to work with all of our 8 focus groups that we have talked about throughout the process of this. We've added a new one to our focus and targeted areas, and that is our jails and correctional facilities. The sheriff is here, and they're moving to implement procedures and protocols to make sure that we are protecting individuals in those. We continue to engage with the business community, both with the issues of helping facilitate individuals not being forced to make a choice of, do I have to go to work sick or pay the rent? I know that there is a lot of discussions, and I have great concern about the status of workers, particularly low-wage workers, the availability of unemployment insurance, the availability of supplemental pay, and I think we take seriously the obligation and charge to make sure that a health issue does not turn into an economic justice issue and is exacerbated because of that. We're working with the schools. Cindy Martin is here to talk about that. Another targeted group are assisted living and skilled nursing facilities. Again, a high-risk, high-vulnerable population. We're in regular daily contact and engagement with those. We're also briefing regularly all of the regional government officials and agencies on all of the steps, along with answering any questions and addressing their issues. At the conclusion of this event today, we will be doing a conference call with all of these individuals. Healthcare efforts continue daily, military efforts continue daily, and our programs around the homeless also continue daily. So as a county, we are working in coordination with the cities, with our healthcare partners, with all of these individuals to make sure that we come together and do everything possible. In a minute, you're going to hear from our public health experts and workers, and I just want to take a second to pay tribute, in particular thanks to our public health leaders. These are individuals who dedicate their entire life to protecting the public health. The situation we're confronting now are the situations that Dr. Wuma, Dr. Evantides, Dr. McDonald, and everyone who works for them trains and prepares for every single day. In the County of San Diego, we believe in public health, we believe in protecting it, and we have great confidence in our public health workers, from the top leadership you hear from daily, all the way down to the public health nurses who are out there every single day doing heroic work to try and tackle the public. And we're very grateful for what they do, and we take seriously their information, their charge, and their guidance. And our county is stronger because of their strength. So thank you all very much for working through that. And I believe we're going to bring up Dr. Wooten to provide more information and context for each of these issues. Dr. Wooten.